Hypercyanotic attack. This is a life-threatening pediatric cardiac emergency, and it usually occurs in infants with a peak incidence between 4 and 6 months. A severe episode may lead to limpness, seizures, cerebrovascular accidents, or even death. The spells may be brief, that's 1 to 2 minutes, and self-correct or may progress to severe life-threatening episode. Prompt recognition by parents and medical staff is very important. And the attack is often early in the morning with no apparent reason. And this may be precipitated following a bath by prolonged crying, defecation, dehydration, febrile illness, or induction of anesthesia. Causes are congenital heart disease, for example, tetralogy of Fallot, pulmonary stenosis, double outlet right ventricle, tricuspid atresia, and it's in Menga syndrome. The symptoms are irritability and prolonged crying, deep rapid breathing, increased severity of cyanosis. And the signs that are usually elicited are tachycardia, systolic murmur, coma, convulsions, hemiparesis. Investigations are FBC, chest X-ray, ECG, echocardiography. And treatment. The main treatment objectives are to recognize a problem early, to reverse obstruction, to correct metabolic derangements in severe hypoxia, also to prevent complications and death from severe hypoxia. Non-pharmacological treatments: hold in knee chest position, teach parents. So the above actions increase peripheral vascular resistance and help to reduce cyanosis. And pharmacological treatments: all children with hypercyanotic attack, you give oxygen 100% by face masks or nasal prongs, 2 liters per minute, monitoring oxygen saturation if possible to all patients to reduce hypoxia. Also, you give 0.9% normal saline or Ringer's lactate, IV 10 milliliters per kilogram over 30 minutes, and then you assess response. Also, you give morphine sulfate, slow IV is preferred, or IM. And if IV line is not accessible, you give 100 to 200 micrograms per kilogram stat. And for patients with poor response to the measures, you add propranolol oral in children 1 month to 12 years, 500 microgram per kilogram. As you give 500 micrograms per kilogram 8 hourly, with a maximum dosage of 5 milligrams per kilogram daily. And you need to give 500 micrograms per kilogram 8 hourly, with a maximum dosage of 2 milligrams per kilogram 8 hourly. To correct acidosis in cyanotic patients with no improvement after 10 minutes of the treatment I mentioned, you add sodium bicarbonate IV for all age groups, 1 to 2 millimole per kilogram. For emergencies, emergency surgical shunt may be required. Maintenance treatment to prevent recurrent attacks pending surgery: you give propranolol oral in children 1 month to 12 years. You give 0.25 to 1 milligram per kilogram, 6 to 8 hourly, with a maximum dosage of 5 milligrams per kilogram daily. And new needs 0.25 to 1 milligram per kilogram. That's 8 to 12 hourly, with a maximum dosage of 2 milligrams per kilogram 8 hourly. I give propranolol slow IV with ECG monitoring. Children 1 month to 12 years, 15 to 20 micrograms per kilogram, 6 to 8 hourly with a maximum dosage of 200 micrograms per kilogram, repeated every 6 to 8 hours if necessary. And also, neonates give 15 to 20 micrograms per kilogram with a maximum dosage of 100 micrograms per kilogram, and repeated every 12 hours if necessary. Referral criteria. Hypercyanotic attack is an indication for early surgery, and refer urgently to a pediatric specialist or cardiothoracic surgeon.